When national leaders speak on public health, their words can instantly shape policy and personal choices. The influence of their statements can ripple through society, affecting not just government action, but also the daily lives of millions of families. In moments like these, the nation pays close attention, knowing that what is said at the highest levels can have far-reaching consequences. President Donald Trump and Health Secretary Robert F. Kennedy Jr. have reignited debate over the causes of autism with recent controversial claims. Their remarks have brought an old controversy back into the spotlight, stirring up passionate responses from both supporters and critics. In October 2025, during a cabinet meeting, Secretary Kennedy linked Tylenol use and circumcision to an increased risk of autism. He cited new studies and called for urgent public awareness, urging parents and doctors to reconsider long-standing practices. President Trump backed these warnings, giving them unprecedented authority. His endorsement amplified the message, ensuring it reached every corner of the country and making it a central topic of national conversation. These statements challenged decades of medical advice and scientific consensus, dominating headlines and sparking widespread concern. News outlets scrambled to cover the story, while experts rushed to respond to the growing public anxiety. Tylenol is a staple in medicine cabinets, and circumcision is a common procedure. Suggesting a link to autism is deeply unsettling for many families. For parents, these claims strike at the heart of everyday decisions about their children's health and well-being. The debate now centers on trust in leaders, doctors, and scientific institutions. People are questioning who to believe and how to weigh expert advice against political statements. Parents are left navigating conflicting information, torn between political pronouncements and medical guidance. The uncertainty is overwhelming, and families are searching for clarity in a sea of mixed messages. In this video, we'll break down the claims, examine the science, and explore what it means for families making critical health decisions. Let's dive in and seek the facts together. The controversy erupted at an October 2025 cabinet meeting, a gathering that was supposed to focus on routine health policy, but quickly spiraled into something far more explosive. During the meeting, Health Secretary Kennedy made headlines by drawing a direct connection between Tylenol, circumcision, and autism, three topics rarely mentioned together in public discourse. He claimed, citing unnamed studies, that circumcised boys are twice as likely to be diagnosed with autism, a statement that immediately sparked outrage and confusion among medical professionals and parents alike. Kennedy went further, blaming acetaminophen, Tylenol's active ingredient, often given for post-procedure pain, as a possible culprit in the rise of autism diagnoses. This theory, which merged long-standing skepticism of pharmaceutical companies with a new and unexpected target, quickly gained traction, creating a powerful and alarming narrative that spread rapidly through the media. President Trump wasted no time in endorsing Kennedy's statements, lending the full weight of the administration to these controversial claims and making them the official government stance. Overnight, what had been a fringe theory was elevated to the level of a national health warning, with news outlets and social media amplifying the message. Kennedy admitted the evidence wasn't conclusive, but still called Tylenol use during pregnancy irresponsible, urging expectant mothers to avoid it despite the lack of scientific consensus. By framing the issue as a moral responsibility, the administration's message put immense pressure on parents and expectant mothers, leaving many to question their own choices and those of their doctors. The result was widespread confusion, anxiety, and a sense of urgency around even the most routine health decisions, as families struggled to make sense of the conflicting information. The administration's claims forced families to question long-standing medical advice and left many feeling isolated and unsure about whom to trust. The debate was no longer just scientific. It became deeply personal and intensely political, dividing communities and even families. The stakes couldn't be higher, as the nation grappled with questions about science, trust, and the future of public health. The administration's advice was blunt: avoid Tylenol during pregnancy and for newborns. President Trump's message was clear: don't take Tylenol if you're pregnant, and when the baby is born, don't give it Tylenol. For pain management, especially after circumcision, he simply said, you have to tough it out. This directive ignored the medical reasons acetaminophen is recommended, such as managing high fevers that can endanger both mother and child. The advice left millions of parents caught between their doctor's guidance and a stark presidential warning. Many now face the risk of avoiding necessary treatment out of fear, potentially putting themselves or their children in danger. The administration's sweeping message oversimplified complex medical realities, offering no safe alternatives. The result: confusion, fear, and a growing divide between political messaging and medical expertise. For families, the stakes are real and the choices more difficult than ever. The medical community responded swiftly and decisively. Leading organizations, including the Society for Maternal Fetal Medicine and the American College of Obstetricians and Gynecologists, reaffirmed there is no proven link between Tylenol and autism. Decades of research show acetaminophen is safe when used as directed. The FDA echoed this, stating no causal relationship has been established. Even Tylenol's manufacturer, Kenvue, reviewed the evidence and found no link to developmental issues. This unified front from doctors, regulators, and industry stands in stark contrast to the administration's warnings. The consensus: Tylenol remains a recommended option for pain and fever relief. The science, not politics, should guide these decisions. Let's take a closer look at what the research actually tells us about acetaminophen and autism. This is a topic that's generated a lot of headlines and concern, so it's important to separate fact from speculation. Most studies so far have found only a statistical association, not a direct cause and effect relationship, between acetaminophen use and autism. In other words, just because two things happen together doesn't mean one causes the other. For example, a major 2024 Swedish study looked at 2.5 million children. At first, they found a small association between acetaminophen use and autism. But when researchers compared siblings, children who shared genetics and environment, the link disappeared entirely. This suggests that other factors, like genetics, family environment, or the underlying illness that led to acetaminophen use, are more likely to explain the association, not the medication itself. Reviews from top institutions like Harvard and Mount Sinai found that while some studies reported positive associations, none could actually prove that acetaminophen causes autism. Many of these studies had significant weaknesses, such as small sample sizes, recall bias, or not accounting for confounding factors. That's why experts agree that more high-quality research is needed. The current consensus among scientists and doctors is clear. There's no solid evidence that Tylenol or acetaminophen causes autism in children. The science is nuanced, but the message for parents is reassuring. You should not be alarmed by unproven claims or sensational headlines. Medical decisions should always be based on robust, well-conducted evidence, not on fear, rumors, or incomplete information. The best available research supports the continued use of acetaminophen when it's medically necessary and prescribed by a healthcare professional. This ongoing debate highlights why it's so important to understand the difference between correlation and causation in science and medicine. In the end, science, not speculation or fear, should guide the choices we make for our families and our health. Expectant mothers face tough choices. Pregnancy brings aches, pains, and sometimes high fevers, conditions that can threaten both mother and baby if left untreated. Acetaminophen has long been the safest, most recommended option for relief. Alternatives like NSAIDs carry their own risks and are often not advised during pregnancy. The administration's advice to tough it out ignores these realities and could lead to worse outcomes. Doctors stress a balanced approach. Use medication only when necessary, at the lowest effective dose, for the shortest time. Avoiding treatment out of fear can be dangerous. For newborns, pain relief after procedures like circumcision is standard care. The administration's warnings have left parents anxious and uncertain, questioning trusted medical advice. In the end, families need clear, evidence-based guidance, not fear-driven directives. The administration's claims sparked backlash, even within the Republican Party. Senator Bill Cassidy, a physician, publicly refuted the alleged Tylenol autism link, warning that pregnant women could be left without safe options. Other GOP senators voiced concern over Secretary Kennedy's influence on public health agencies. Reports surfaced of CDC officials being pressured to adopt unproven policies, leading to high-profile dismissals. Critics argue the administration is prioritizing politics over science, risking public trust and effective health policy. This is not just a partisan issue. It's a fundamental debate over how health decisions should be made. The controversy has exposed deep divisions over the role of science in government. The Tylenol controversy is part of a broader campaign by Trump and Kennedy to question mainstream science on autism. Both have long promoted the debunked theory linking vaccines to autism, despite overwhelming evidence to the contrary. The administration's focus has now shifted to Tylenol, but the pattern remains, targeting common medical interventions. Trump has exaggerated vaccine numbers, fueling public doubt. The administration is directing research funds toward environmental causes of autism, including vaccines and acetaminophen. Critics worry this diverts resources from more promising genetic research. The appeal of simple explanations for autism is strong, but science shows the reality is complex. Recent FDA-approved treatments for rare autism symptoms highlight real progress, but not in the areas the administration targets. The debate is less about science and more about narrative and politics. In a world flooded with health information, knowing who to trust is harder than ever. The Tylenol autism debate is a reminder. Your best guidance comes from qualified medical professionals who know your situation. Despite political warnings, the global medical consensus remains: Tylenol is safe when used as directed. Avoiding treatment out of fear can have real risks, like untreated fevers harming mother or child. Open conversations with your doctor are essential for understanding risks and benefits. Critical thinking is key. Distinguish between political statements and scientific evidence. The search for autism's causes must continue, but decisions should be grounded in the best available science. For families, building a relationship with a trusted healthcare provider is more important than ever. Science, not speculation, should guide your most important health choices. Trust expertise. Your family's health depends on it.